This is a facial video. And before we even have our appointment arrive, there's a few things that need to happen. So we need to disinfect our workstation, bed, and equipment using a disinfectant wipe following manufacturer's instructions. We need to check all of our equipment to ensure all devices are in safe working order and plugged into a working receptacle. We gather clean supplies needed for the facial service. We store in a clean enclosed container. We turn on the hot cabbie and stock with at least 3 clean wet towels. More may be needed depending on the service and the client's needs. We fill clean steamer glass with distilled water and we preheat the steamer. We dispense products needed for the service according to the skin type and client's needs as follows. We prepare disposable portion cup or tray for each product with a portion of the product by opening the top of the container and ensuring that the tip of the nozzle does not come into contact with the disposable portion cup tray. Or you can remove the product with a disinfectant or clean single-use spatula and then close the lid to the product and set the portion cup or tray on the tray. We drape the facial bed using 1 fitted sheet, 1 flat sheet, and 3 towels. We place the clean laundered sheets down on the disinfected facial bed, placing a towel horizontally at the head of the bed. We lay a hairnet and headband on top of the first towel, along with a rolled towel to support the head and neck of the client, and we save the third towel to lay across the client's décolleté. Then, when the client arrives, of course, we're going to meet them with cleansed hands. We're going to do another hand wash, but we always greet them with clean hands, and then we escort them to their work area. We determine the client's preferences, and we assess the client's needs. We assess the client's skin by performing a visual skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation to prevent this from safely performing the service. We assess the client's consultation form for any medications and products used within the last 72 hours. We consult on any known allergies. We consult with client on any facial surgeries within the last 3 months and if the client's under a physician's care. We assess if the client is prone to cold sores or fever blisters. We assess if the client has used exfoliating or lightening agents within the last 72 hours, such as alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. Always suggesting a sunscreen. We assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. If the client is free from any of those contraindications, then we can move forward with the procedure. And our client is fine, so we will then get the client set up and comfortable. We will have the client disrobe appropriately in private, and then we will get them comfortably into the bed. Then we have our rolled towel that we're going to place underneath our client's neck for comfort. And then we have a headband that we're going to apply. And unfortunately, this headband doesn't stay on very well, but I'm going to try my best with this one today. Try to make it nice and tight. Maybe that'll help. Keep it on. We're going to place a towel over the décolleté here, and she is comfortable and ready to go. And just showing you my setup, we have the third towel here, and then we have our tray ready to go with all of our disposables and what we need to perform the service set out. And we are going to get started. So, first step is the cleansing process. And we're going to stop right there because I forgot something. So we're going to start all over on that part. After the client is comfortable, before we start the facial, we have to wash our hands. So this is my first facial of the day, so making a mistake right away. So we're going to fix that mistake. So the client has just been made comfortable. She's got all of her things on, and then before we start the treatment, we wash hands. So we are going to turn on the water, and we're going to put our hands under running water. We're going to take some liquid hand soap, and we're going to wash our hands, the palms all the way down to the wrists, the back of the hands down to the wrists, we're going to wash between each finger, fingertips and nails, of course, backs of the fingers. We make sure when we're doing this, we do it for at least 20 to 30 seconds. We wash our thumbs, we wash our wrists, and then we thoroughly rinse our hands under that water. We grab a paper towel and we turn off the water with the hand with the paper towel, and we dry. After a proper dry, we throw the paper towels in the trash, and then to finish our hand wash, we use hand sanitizer. Now we are properly ready to start our facial. Okay, do over. Here we go. do our first cleanse. Or the little headband. Now we need to do a good skin analysis. So we need to protect your eyes, or his eyes, your client's eyes. We're going to cover them up, and we're going to bring over the magnifying lamp and turn it on. And I'm going to pretend like I have a magnifying lamp here, and I do. So we're going to do that. So what I'm going to do is get in here and do a real good analysis. And what I want to do is I'm looking for different things like dehydrated skin, flakiness, fine lines, freckling, excess sebum, things that she's asked me to look for, my clients asked me to look for, and I'm going to just really give it a good look over, so that not only will I know kind of what we're doing, focusing on today, which we've discussed already, kind of areas that I might need to do extraction, etc. I'm also going to be thinking about treatment for the future for her, like where to go, next things to recommend, and also products that would be great for her that she could support with at home. So I take a few minutes here to really give that a good and proper check all over the face and the neck and chest. So we're doing that right now. And I'm definitely seeing, you know, so obviously some flakies and some dries and some things that need to be addressed. So perfect. So we're going to turn the light off and take it out of the way, and then I can remove the cotton pads, and then we're going to go back and do our second and our third cleanse. Now third cleanse. And now we need to tone. And after we've cleansed and toned, we're going to exfoliate. So what we need to do is we're going to start by applying some exfoliant. and based on what you choose and manufacturer's instructions, you're going to massage the exfoliant in for 1 to 2 minutes first. Now, once her exfoliator's on and you've massaged it in, that's when we're going to bring over the steamer. So what we have to do is retrieve that facial steamer and turn the steamer to the on position. And we're going to position it next to the bed, the facial bed, but we're going to face it away from the client. Pardon me, as the water heats up and emits an even outflow of a mist. Once the steamer is emitting a mist, we're going to position the steamer 16 inches over the client's face and aimed at the client's chin for even distribution on the face, allowing the unit to function for 3 to 5 minutes. So we would bring it over here, turn it on, have it facing away from the client until it's ready, and then we're going to turn the facial steamer towards our client, but toward the chin so that it will go up and out for that even layer. We don't have a facial steamer here, so we're going to move forward. We're not going to wait for 3 to 5 minutes for that to happen. We're going to pretend like we did that. And what we're going to do now would be to go to the hot cabbie for the towel. And once again, I don't have a cabbie, but I'm going to pretend that I do, and I'm going to go get a nice hot towel. So I'm going to take my towel out of the cabbie, and I'm going to shake it out because it's hot. And the first thing that I'm going to do is I'm going to check it on my wrist to make sure that it's not burning hot. And then I'm going to, once it's comfortable to me, I'm going to check it on the client's collarbone, and she says it feels great. So I'm going to get my nice towel here, and we're going to bring it over to the client. And we're leaving her nose out, of course. after exfoliation, we are going to be moving into a process called extraction. And so for that, we have to put gloves on. Now there's a couple of methods of extraction that can be done. You can use wooden cotton stick applicator soaked in astringent, and you would use a pair for every extraction. Toss it, use it again, toss it, get new, toss it again, get new. So for this facial video, I'll do this. You can also use the finger method with like a cotton round soaked in astringent, 2 of those. So but that you don't have to throw away between each one, you just move around. I'm going to use this one, so I'm soaking in astringent. And I'm going to come in and do extraction. And then I'm going to throw it away. And I'm going to pick up another pair, soak them in the astringent, coming in. And getting another set. And she is good to go with that. So we can remove our gloves, throw them away because they are disposable. And now we have to tone. And during the extraction process, you really want to keep it to a minimum, 3 to 5 minutes, no more than that, 5 to 7 minutes. You don't want the clients to be uncomfortable, and you don't want the client to be in too much discomfort. And now, after all that extraction, good news is that she's going to get a nice massage. So we're moving to the massage part. My poor headband won't stay on. Okay, massage is done. She feels asleep. And it's time for her mask. So we did massage, we removed the massage product, and now we are going to apply a mask. And I'm going to be using a fan brush for this. You want to make sure you avoid the eye area and the nose and the mouth. You don't want to get it in anywhere. There. And when you're applying the mask, or you obviously figure out the type of mask that you're going to apply, and then you're going to read and follow the manufacturer's directions. The mask will be sitting on the face based on the manufacturer's directions anywhere from 5 to 10 minutes. But for the sake of the video, we will not be leaving it on for 5 to 10 minutes because we are clearly just moving right along. So we're going to pretend like whatever our timeline was or guideline was that we met it, and we're going to remove the mask. Skin looks amazing. We're gonna finish now with toner. And we are going to then apply an eye cream and a moisturizer. It is daytime, so I'm going to make sure that I apply the moisturizer with sunscreen. Let's start with eye cream. Take a little bit of eye cream. We're going to apply that to our ring fingers. And then coming in, we're going to do a little tapping motion, making sure that we hit the brow bone and the sagittal arch. Teeny bit. And then we were going to go over here and get some moisturizer with good sunscreen. And we're going to apply that everywhere that she might be exposed to the sun. We'd already discussed the importance of an SPF. I'm going to probably apply a little bit to the ear too if her ears are exposed. Definitely the neck and the décolleté. And where that she might need it. Skin looks and feels amazing. I know that she's going to be definitely relooking. We're going to talk about her follow-up in just a minute. And it's at this point that I would excuse myself and let her get changed. And then we would meet and discuss maintenance and aftercare after this facial. We would discard all single-use items like our sticks, our gauzes, etc. We place our implements in a closed container labeled to be disinfected, such as like the fan brush. Pardon me. We place cape, towels, sheets, anything that we've used like that in a closed container until laundered. Our work area needs to be cleaned and disinfected. So we're gonna identify proper cleaning agent and read manufacturer's directions. We'll follow those manufacturer's directions for mixing and usage. We're gonna wipe down our workstation and area with cleaning solution to remove debris. Then we're going to identify a disinfectant that is bactericidal, virucidal, and fungicidal, EPA approved for use in salon setting. We will follow manufacturer's directions for mixing and or using appropriate aerosol disinfectant. We will disinfect electrical equipment and store it in a clean area separate from other implements. And once we've done all of that, we will wash our hands. So we obviously had gloves on because we were using something that's bactericidal, virucidal, and fungicidal. So take your gloves off and then turn your water on, dampen your hands, get your coin-sized liquid soap. You're going to rub your palms together all the way down to the wrist, and then you're going to clean the back of the hands down to the wrist. We're going to clean between each and every finger, and of course clean those fingers thoroughly. We are going to clean the backs of the fingers. We are going to clean our nails and the fingertips. We will clean between, and we're going to make sure we're doing all of that underneath the water to a good 20 to 30 second minimum. We're going to clean our thumbs. We're definitely going to clean our wrist down to our wrist, and then we're going to rinse thoroughly. Once we have that big proper rinse done, we are going to grab a paper towel, and we're going to turn the water off with that disposable towel, dry our hands, arms, everything thoroughly, dispose of the towel, paper towels, and then to finish your hand wash, you're going to locate your sanitizer, of course, and you will 150% sanitize those hands like you just did your wash thoroughly. And when everything is dry, your hands are completely dry, you can then set up for your next client, or you can be done for your day, whatever your schedule is. And that is the end of this basic facial video.